Hi, my name is Lynne Borges. I'm the pharmacist at the Walgreens here in Clinton. I am at the Clinton Senior Center for their Caregiver series. Today I'm going to help you navigate the pharmacy. First topic for caregivers today is the importance of medication adherence. So there's a couple aspects to medication adherence. One is medication compliance, and that is where patients are doing what the prescribers want the patients to do. Second component is what medication adherence actually is. It is taking the right dose at the right frequency at the right time. And there's a lot of involvement, especially with the caregivers, in navigating medication adherence. Did you know that lack of medication adherence is America's other drug problem? About 12% of Americans don't take their medications as they should. It can cost up to $2,000 in additional medical bills. The problem that not taking your medications can cause is that the medications can't work if you don't take them. Medications are powerful tools that prevent health conditions if used as prescribed. Not taking a medication can result in poor health condition control. It can also take time to find the right medication regimen that will work for you. So if problems come up, address them with your prescriber. Here are some common problems with taking the medication. A lot of times you'll start to feel better and you don't feel the need to finish the medication. You could be having a hard time remembering to take the medication. You could be seeing a lack of results from taking the medication and stop. You may not know what to do if you miss a dose, or your medications may be too expensive. So here are some tips on how to take your medication better. It is important to communicate with your healthcare professionals, even the pharmacists, the doctors. If you're experiencing side effects or you feel that it's not working, talk to your healthcare professional and let them know, and it can be addressed. It is important to become an expert on your medication. Get organized, use a pill minder system, have a list of your medications, and any over-the-counter supplements that you're taking so you can take to the pharmacy and to all the different doctors that you're seeing. And it's really important to choose one pharmacy so that everyone knows where to pick up the prescription, and they'll know side effects and drug interactions if you keep to one place. So we'll start with open communication with your provider. Be honest and vocal. You are your own best advocate. If you're feeling anything that you don't think is right, or you feel it's not working, the healthcare professional can't help you if you don't bring it up. So inform your doctor if you are having a hard time remembering or having side effects, if the costs are too much, and ask for advice. Here are some tips on how to become an expert on your medication. Make sure you know what the medication is used for, whether it is a brand or a generic. Make sure you know where to keep the medication. Does it need to be refrigerated? Is it at room temperature? Know how much to take, when to take it with or without food. And then what should you expect from the medication? Is it making you feel better? Is it making you feel worse? Is there anything that you need to monitor, such as if you have diabetes, you need to be testing, or if you need to upkeep lab work. So be an expert on your medication. One way to help is to keep a medication record. So a list of your medications, the strength, how often to take it, who is writing the prescription. Keep that copy on you, bring it to the pharmacy, bring it to all of your doctor's offices. One doctor may not know what the other one is writing for, and make sure you keep it updated. Any changes, just print out a new list or We have lists that we can provide you, and we can continually keep that updated. So get organized, set a routine, keep your medications where you'll notice them. Try using a pill minder box, keep a written or computerized schedule, or keep it on an app. These days, apps can remind you to do pretty much anything. Or ask your family or friends, so as a caregiver, if you have any support there to help you remember to help your loved one take the medications, that would be great. Another way to keep everything on track is to keep to one pharmacy. That way, if you're on an automatic refill, or they have the automated reminders that'll go out, they're all coming from the same place, and they kind of lump everything together. It is safer, and it avoids confusion. It avoids duplicate therapies if you're seeing multiple doctors. It is the easiest way to prevent drug interactions. And make sure you choose a pharmacist as if you're choosing a doctor. So that relationship really helps allow us to know you and for you to know us. So if you have any questions, you can address them easily if you keep to one place. Keep in mind that all people have a hard time remembering to take their medication. It's not just you. If a medication is not taken or is not taken as prescribed, it's not going to work. If you need tools, ask for help. The pharmacist or your provider is always there to help you. One way to help is our next topic. It's the Walgreens app. It is available on the Apple App Store, Google Play, or if you have Windows, the Windows Phone Store. It is free. The Walgreens app can allow you to do refills on the app. You can scan it. You can click off a list. You can keep track of multiple members in your household. You can transfer prescriptions if you have a prescription from another pharmacy. You can take a picture of that pill bottle, send it to us, and we can get that information and then kind of put everything all into one pharmacy. It gives you a history of your prescription status. It has a pill minder with a little alarm for when to take your medication. You can order contact lenses off of it. So the refill status tracker kind of walks you through the process. So when we get the prescription in, it'll say pending. It'll let you know when the prescription is ready or if we need additional information. You can send us a picture of updated insurance cards as you get them, so you don't have to bring it in or give us a call. We also have access to MD Live. It's a doctor consultation service. Through the app, you just call them. They can answer really simple health questions you have, like whether you're cold, you need to actually see a doctor, or if you can self-treat it at home. The app also gives you options on your rewards. So Walgreens has their balanced rewards system. So it gives you access to their flyer, their coupons. The Walgreens mobile app also has photo capabilities where you can upload pictures from Facebook or your phone or Instagram. You can create photo gifs, cards, printouts, share them with others. You can also shop on the Walgreens app as well. So if we don't carry a product in the stores, it'll tell you that it's online only, and we have a very large selection. You can do ship to store for free shipping. If you're not going to be around to sign for any packages, you can also have items shipped to your home. Try to make it as easy as possible for you. So the last topic for today is on safe medication disposal. So what do you do with those medication bottles that are lying around the house? Expired, unwanted, or unused medications should quickly be removed from your home to avoid accidentally taking them and to prevent the unintentional misuse of unneeded medication. There's a couple of different disposal options for you. You can either follow the instructions on the prescription label or the patient information packet. Make sure you do not flush medications down the toilet or the sink unless specifically instructed to do so. There are drug take-back days that are run by the DEA. Those are listed on their website, or you can call them. The number to the DEA is 800-888-9539. The local police department here in Clinton has a kiosk that you can drop off unused medications as well. The store also has drug takeaway bags that you fill up, seal, and it goes to a disposal facility. So make sure that when you do send back your medications, or if you drop them off, that you remove any of the original labels. You don't want any of your personal information to get out there. For those medications that you want to get rid of right away, the DEA recommends placing them into a sealable bag and mixing it with a substance that will prevent leaking and that no one's going to want to take from. So coffee grinds that are used or kitty litter mixed in so that no one's going to take the medications that are in it. And then those you can throw in the trash. Some flushing guidelines. There are certain medications that are high risk and that the DEA has deemed safe to flush. They are constantly updating the list, but again, remove any labeling. It would be like a common one would be the fentanyl patch because it's so potent. It's a potent pain medication. There's still a lot of medication left on the patch, so you would fold it over and flush that down the toilet. The DEA website or the FDA website, which is on the handout, has a list of medications that are flushable. There aren't that many, so it's always good to check with the pharmacist. And that'll prevent overdoses if it's lying around and you have pets or children or other adults in the household. Some additional suggestions. Make sure you're not sharing unused medications with friends. When in doubt, ask about how to properly dispose of your medication. The same medications that we described for prescription drugs, you can do for over-the-counter drugs as well. So if you have a Tylenol bottle that is 10 years old, get rid of it, and there are safe ways to do so. There are concerns about flushing medications down the toilet and getting into the water supply, which is why the FDA has a strict list on what is flushable and what is not, because there are certain medications that cannot be taken out of the water supply, and you don't want the water supply to be deemed unsafe. There are other medications that are fire hazards, such as the inhalers. Some of those propellants are potentially dangerous if punctured or thrown into a fire. So you want to make sure that you're safely disposing of the canisters for the inhalers as well. So some authorized collectors, we'll just go through really quickly again. The drug takeaway days, I believe in the area, it's in the fall, Berlin does a drug takeaway day, and so does Marlboro, and they'll announce those on the reader boards around town. The DEA has also said that I think they have set up a kiosk at the police department, and Walgreens sells the takeaway bags. I believe they're a couple dollars, and you fill the bag and stick it in the mail for disposal. So if you have any questions, feel free to give the pharmacy. Again, I am at the Walgreens in town here in Clinton, and my name is Lynn. Thank you so much.